Good morning, good afternoon, and good evening to everyone. My name is Joanne Pasek, and I am the founder of Global Health and Wellness Medical Tourism Incorporation, or GHW Medical Tourism Incorporation. Today's topic is about Turkey medical tourism. I want to share to you very briefly why I would like to share about tourism in Turkey. Few days ago, I have a client inquiry, and this client specifically wanted to pick Turkey, choose Turkey. Although the clients have other alternative or other destination as the conversation goes, but he mentioned that he wanted to check Turkey since he started already doing his own research. The Global Health and Wellness Medical Tourism Incorporation, how I deal with the clients and the patients, I have to ask first and foremost, what is the reason of going to Turkey or other country beside, and I know doing the medical thing. Let's say this particular client wants a preventative checkups, meaning from head to toe for male checkup. Although there's a lot of questions maybe that you're gonna ask right now while watching and listening to me. Why going to Turkey? Is that possible here in Canada, or is it possible in where they at? The example that I am going to mention, or not example, it's what's the situation here in Canada. The medical service plan where I'm at located, that's called MSP, cover some of the medical expense. But in terms of other checkups, in terms of other lab report or result, if it's not really necessary, if the doctor it has nothing to have something to say, like, okay, you need to do this test, okay, I found you some issue that needed attention. So that's the time when the doctor or the physician that looking after the patient here is gonna require a extra lab report or test for you. So that is covered by the MSP. In some occasion, in some situation, some patients would like to have a test, specifically to run a test for everything from head to toe, just for preventive measure. Now, in this case, that is not gonna be right away that the family doctor or the physician will give you a referral, will write you a letter and stated that, okay, you have to go to the laboratory or you have to go to the certain test, then you can do that and covered by the government, unless the physician will have to prove, and there's some ongoing investigation that why the patient or the client needs to go to a certain test. In this case, the problem with the medical situation here, and I bet in some other countries too, not unless if this is not the same in here in Canada medical system, but I'm only focusing here in Canada. So the client my client requested an extra test for preventive. So the doctor did not follow through because there's no need, according to the physician. But the patient or the clients feel like it, that he wants to, because he wants to be proactive. In this case, now the patient itself can change a perspective that if it takes longer in here, if the physician, my physician itself, will not gonna give me a referral or hesitant to give me such and such test, so that we'll see whether I'm in good health, and then nothing to worry about. The bottom line is preventive checkup. But then some doctors are reluctant to that for some reason, if there's nothing to worry. But it is by the patients, by the clients, or individual choice and opinion or suggestion that they wanted to do a preventive checkup. So that's why this patient or the client that I talked with this week decided to check out in other countries that offer a preventive checkup. That's where Turkey is the topic today. So in that sense, when the clients came up to me and said I wanted to go to Turkey or try Turkey, then just to scale it down, which is the best. So my job is to look at the hospital, the best, and with the credential. That's the very important thing that I first check to the facility. So in this conversation, we decided that right at the moment I have to make an arrangement with the patient or with the clients and the Turkey hospital. It will appear on the screen, the name of the hospital, whom that I've conversed with the consultant, and I'm in the middle. So I'm the facilitator, and the client and the patient is here, and the consultant that's direct or employed by the hospital is in both in on the other side, and I'm in the middle. So in that case, I am only giving the best hospital for my clients that I know the reputation and has the international accreditation. So in that sense, I am competent when I have to tell the client this is the best out there. But the bottom line, it's going to be up to the client and to the consultant if they go into agreement. But I can only give my best opinion, and based upon all the review, based upon the international accreditation of the hospital. So Turkey is known for top-notch medical tourism, but it is very important also for the client and for the medical facilitator who's not assigning to any one of this hospital. The medical facilitator, or my job is to be at the middle and to know that I am going to make the better decision for the client and also for the hospital, that the hospital will deliver the best for the client. So in that sense, I am not gonna make a decision to coerce the patient, like, okay, this is good hospital. I mean, trying to convert the patient's mindset that this hospital is best. But I will remain as in the middle and give the best I can based upon my review on that particular hospital, and that will appear on the screen.